the program, Rich mentioned that a video played in the earlier hours of the convention last night focusing on one family's health care struggles and how it really seemed to sell the notion of Obamacare in a way that perhaps the Obama White House has not done. We want to get your take on it, but first, here's that video in its entirety.
My name is Stacy Lynn. I'm from Phoenix, Arizona, and the Affordable Care Act is saving my daughter's life. I was still pregnant with Zoe when she was diagnosed with a congenital heart defect. The doctor proceeded to tell us there's actually a set of 3 open heart surgeries required for her to survive. So her first surgery took place at 15 hours old. Her second surgery took place at 4 months old, and she's awaiting her third and final surgery so that her half a heart works for her entire body. Before the Affordable Care Act, health insurance companies were allowed to set lifetime caps on how much coverage each individual was provided. By 6 months of age, Zoe was halfway to her lifetime cap.
That's an orange.
Here's insurance that you've been paying for the past 20 years, but don't have a child that was born with a heart defect, because once you reach a certain limit, we're not going to insure them anymore. Thankfully, in March of 2010, the Affordable Care Act was passed, and I remember getting a letter from our insurance company telling us that there are no more lifetime caps. It was a huge relief for us to know that we didn't have to worry about that. Zoe's made us live a little bigger and a little brighter every day, so we don't take anything for granted. My family needs President Obama to be reelected because we need the Affordable Care Act to stay intact.
An effective video, Democratic strategist Dowdell. How do you convert that video into a campaign theme from now into November?
Well, I think I would take snippets of that video, the most compelling portions of it, and I would incorporate them into ad campaigns, into print ads that go out, direct mail that goes out to people's homes. I think it's very important for the president to push back forcefully on Obamacare and its merits. And I think, unfortunately, they're starting late, but I think that the president needs to do this. He needs to make sure that people understand his policies in very real terms. And that's why I think Michelle Obama's speech was so compelling. There was one line in her speech that I thought really stood out, and it sort of encapsulated all of these policies that the president has been fighting for, when she talked about when you do a good job and you walk through that door of opportunity, don't slam that door of opportunity. Open it so that the next person can come through. Let
me flip the question on you then, because if you're the Republicans, how do you counter that without coming across as the guy who wants to take health care away from that little girl?
Well, I think what the Republicans have been doing is they've been pretty masterful, because the Republicans have been running for a long time what I call a fear and smear campaign against many of the president's policies. And I might add really quickly, a lot of the policies that they're running the fear and smear campaign against, like the individual mandate, they previously supported those very same policies. But that's another issue for another show. But I think what the Republicans have done is they do a great job of sort of turning things around. So now all of a sudden they're in love with Medicare. Republicans have been trying to get rid of Medicare since the beginning of time. I mean, it's sort of ridiculous to hear Paul Ryan, whose budget cuts Medicare, turns it into a voucher program, attacking President Obama for finding savings in Medicare by basically not paying insurance companies $1.10 on the dollar to provide Medicare.
If you're Republicans, you run against this quite easily. You entail it as big government telling you what to do with your health care issues, and it's more big government. Remember, there are 2 themes here. The Democrats, big safety net. Republicans, less government is good. And so if you're Republicans, you say, listen, this is Obama pushing down your throat what he wants for you, and you're going to pay for it. And by the way, the Supreme Court barely approved it by the narrowest of margins.
Though there is risk for Mitt Romney on this, because, you oppose health care, you oppose not just this little girl's health, but also that's the program that he instituted in Massachusetts when he was governor. We heard that from Deval Patrick last night. We're going to take another quick break here on RFL. Please stay with us.
And I think the message really needs to be it's not only about re-electing President Obama. We really do need a change in the Congress. One of the big frustrations that I have, and I think that many have, is that the president has had some specific plans, and I really think it's part of a political calculation just to deny him any success.